Hello, my name is Professor John Frank. I'm a physician epidemiologist and expert in public health, based currently at the University of Edinburgh in Scotland, but historically at the University of Toronto for a quarter century. I'm going to be talking about what has led me to become concerned about safety issues related to 5G telecommunications and indeed earlier generations of telecommunications designed to support cell phone, mobile phone networks. I got involved in this only in 2019 because a Scottish public health activist with no vested interests did some reading and said there's something, quote, fishy going on with the rollout of 5G telecommunications across much of the Western world. I think you should have a look at it. And in the interim, I've read a very large amount of material. I've got a lot of background to help me sort the wheat from the chaff in this scientific literature. I've been both a GP and a public health physician for 40 years, some of it in East Africa. So I have a lot of clinical experience with diseases most Western physicians have never seen. And I'm very used to assessing the quality of scientific evidence about hazards in the environment, in our diet, in our lifestyle, and so forth. When I began to read this literature, I began to sense there was something worrisome about the safety issues that had been documented, or more importantly, not documented by high quality research. What was surprising to me above all was that not only did I have no prior exposure to this issue, but when I spoke to my Scottish, English, and Canadian public health research colleagues, they'd never heard of this controversy either. Somehow it had just never got discussed. And indeed, you will not find virtually any coverage of it in the media on an average British day. However, as I'm about to explain in more detail, meanwhile, very dense networks all over the Western world and increasingly in the middle income countries are being put up to support 5G telecommunications. I knew that phone users wanted new technology, especially high bandwidth that would provide continuous connectivity everywhere all at once. I was not aware until more recently that much of the market for that relates to driverless cars and the Internet of Things, which is the system of speaking to your appliances and home heating system from a distance and having them all interconnect. I decided that I needed to investigate the issue by reading around it and speaking to experts without any external funding. I did that over a few years, read hundreds of scientific papers and policy documents. And this is really what I found. Well, as a result, I did publish a peer-reviewed commentary, and the citation is on this slide, which attracted a lot of attention, I think because I laid out the issues in fairly plain English. Since the publication in 2021, I've done even more reading, hundreds more papers, and I have no reason to change my views, which are, as the next slide says, very much concerned about the world sleepwalking into a potential health and environmental disaster related to the poorly documented adverse effects of 5G EMFs and some of the electromagnetic fields related to previous generations of telecommunications, which were understudied as well. And it's sleepwalking because the world is sleepwalking because most health professionals know nothing about it. So if I summarize in 5 brief points what the concerns are, the first is that there's a massive rate of proliferation of 5G telecommunications systems throughout the world. It is driven entirely by the commercial interests that I described earlier. But if you look for human studies or even animal studies in the lab of this related to the safety of the electromagnetic fields from these systems, there's almost no studies, and certainly virtually none at all of the newer types of quite different 5G telecommunications electromagnetic fields. And that is partly because the new technology is protected by patents owned by big telecommunications companies and not accessible to independent researchers. The second point I would make is that if you look closely, there is an emerging body of research of high quality suggesting that even the earlier generations of telecoms technology had subtle but sometimes quite delayed health effects. First, we have evidence of biological effects in the lab, spanning not only many body systems in human beings, but also animals of various kinds. And there's increasingly good human studies in using data from free living populations of people in the community, which are beginning to show a relationship between exposure 20, 25 years ago to early mobile phones and delayed diseases such as cancers. 2 brain cancers, one typically fatal, glioma, another can be quite disabling, acoustic neuroma, appear to have each year that passes, more and more evidence accumulates. And the reason that is true is that cancer takes up to 20 to 40 years after exposure to cancer-causing influences to develop and show up clinically. And therefore, would be expected that earlier studies did not show these links. Thirdly, there is more evidence than I had realized, and again, accumulating each year, that many global and many national, major global and many national regulatory agencies for these exposures that are supposed to regulate our population's exposures to electromagnetic fields have been captured by vested interests in the form of big telecommunications corporations. So much so that current safe exposure limits in much of the Western world are outdated, ignore recent research, and are inadequate for public safety. Fourthly, at the federal level, in the UK, most national level, we would say, much of the EU, USA, and Canada, there is legislation or regulation in place which preempts local planning processes from even considering health and environmental concerns of local citizens when they're hearing applications for new 5G or similar installations. Those matters are typically reserved for national level authorities who have the, quote, requisite expertise scientifically. But this means that the local citizens concerned about these issues are restricted typically to expressing aesthetic concerns about the appearance of the transmission tower and nothing more. And finally, this is new to me since I wrote the article in 2021, many hundreds, in fact, that's an understatement, many thousands of low altitude satellites for global 5G transmission are being launched by private corporations such as SpaceX and its competitors in order to support 5G because its higher frequency carries more information per second, but it is interrupted by mist, snow, rain, foliage, and so there's to be a much denser system of transmission support. And of course, all such satellites over time age, they lose orbital altitude, developing malfunctions, and they will present unpredictable aerial and ground hazards. The most worrisome thing is that the numbers being launched are far in excess of what is needed globally because it's a competitive market model with several firms, each launching their own fleets of satellites. So this obviously is a system of non-governance, which is unsuited to public spaces and the protection of the public's health, as well as preserving the environment. As a result, I and many other experts internationally have called for a moratorium on the 5G rollout, pending the completion of high-quality, independent research into safety and the potential adverse effects on other species and on the environment itself. As a result of that publication, I was contacted last year by the International Commission of the Biological Effects of Electromagnetic Fields and invited to be a special advisor. It's important to note that ICBE is entirely nonprofit and the role is entirely voluntary. No one receives any remuneration of any kind in these advisory roles. Working with other members from many different scientific disciplines, we are attempting to keep an eye on studies that are being published regularly every month, many of them purporting or claiming to have reviewed the scientific evidence globally on various specific health outcomes that have been linked by a few studies to electromagnetic field exposure of this sort. And what we're finding is that there's a very low quality, scientifically speaking, of study being published, which typically tends to reassure people where the reassurance is not valid, because the epidemiological methods used to draw conclusions from previous studies are weak. And we, of course, are writing those up and they're submitting those critiques of other people's reviews to a peer-reviewed journal in hopes that we can influence the debate internationally. In the interim, I provide entirely on a pro bono or voluntary basis the best advice I can to citizens who are worried about the installation of new transmission mast towers in their community. And I frequently have to inform them to their dismay that they will probably not be allowed to bring health and safety or environmental concerns to the local planning meeting. They can only talk about the appearance of the tower, but at least they know what they're up against, and they're terribly appreciative. Until something is done to deal with this, I would say, now rather inappropriate regulatory system and correct its lack of scientific foundation, I would say that the regulators are, in fact, to borrow Bruce Springsteen's song title, dancing in the dark. Thank you.